Okay, let's dive into a really interesting stack of sources today. It's all focused on, well, how healthcare is changing, specifically this big shift towards technology in patient care telehealth.
Right. And we've got quite a bit here, material covering, the basics, what telehealth actually is, the upsides, the challenges, but also insights from a company that's pretty deep into the healthcare infrastructure side, investments, services for hospitals.
Yeah, and what's really interesting, I think, is how one of the main sources that goes deep into telehealth itself, practical tips for you and everything, it's directly linked to that same hospital services company. That connection feels significant.
It really is. So our mission today basically is to unpack all this, understand what telehealth involves, how it's impacting, well, you as a patient, but also the wider system, and crucially figure out why a company focused on like actual hospital buildings is also talking so much about virtual care.
Exactly, because the stuff matters to you, right?
Yeah.
It's changing how you might see a doctor manage your health. So let's start there. The sources define telehealth, but they make it pretty clear it's more than just hopping on a video call.
Oh, absolutely. Yeah, the core idea is using digital tech for healthcare. Simple enough. But the scope, well, the sources show it's way broader. Think primary care check-ins, mental health sessions, managing chronic diseases, even specialist consultations.
And they break down the different types, too, showing how varied it is. There's telemedicine. That's probably the one people think of first.
That's usually the remote diagnosis and treatment part, yeah.
Yeah.
Often that live video chat or maybe a phone call. But it's really just one piece of the puzzle.
Okay. Then you've got remote monitoring. That sounds really important for, long-term health issues.
It is, definitely. This is where you use devices, could be wearables, smartwatches, other specialized gear to track vital signs, heart rate, blood pressure, glucose, whatever it is, from home. The doctor gets the data without you having to constantly go in.
Saves a trip. And then mobile health apps.
Right, those apps on your phone. For tracking fitness, booking appointments, getting medication reminders, maybe wellness tips. The sources kind of group all these things, telemedicine, remote monitoring, the health under the telehealth umbrella. The goal is making care easier to get, more efficient.
So it's like a whole toolkit of digital options,
Yeah.
which leads to the big question, why is this gaining so much traction now? What are the main benefits the sources are pointing to?
Well, the number one reason, almost always, is accessibility. It just knocks down barriers. Geography, for people in rural areas or far from clinics.
Or even mobility issues, right? If it's hard to get out.
Exactly. And fitting care into busy schedules. The sources also mention virtual waiting times are often shorter, which is a plus.
That accessibility point seems really interesting coming from sources linked to a hospital infrastructure company. I mean, does more remote access change how hospitals operate, how they manage patient flow? Does the material hint at that?
Well, the patient-focused stuff obviously talks about convenience for you. But yeah, you can see the connection. If virtual visits are efficient, if wait times are shorter, that helps the providers too. Better use of doctor time, maybe less pressure on physical waiting rooms.
Ah, okay. So the why for the system could be efficiency and managing capacity alongside the benefits for patients. Makes sense. What other upsides are mentioned?
Convenience is a huge one, obviously. No travel time, no parking hassle, flexible scheduling, and the reduced risk of exposure. We all learned about that during the pandemic, didn't we?
We certainly did, minimizing time in crowded waiting areas. And the source mentioned something about privacy and comfort, too, for sensitive topics.
Yeah, the idea that discussing health concerns from your own home, your familiar space, might make some people feel more comfortable, more willing to open up to their doctor.
Interesting point. And what about that remote monitoring piece, again, managing chronic conditions? The sources suggest it could actually cut down on hospital visits. That sounds like a pretty big deal for the traditional hospital model.
It really is.
Yeah.
If you can manage conditions like diabetes or hypertension effectively with remote data, make timely adjustments to treatment, yeah, it could potentially shift some care away from needing hospital stays towards more ongoing preventative virtual management. That's a fundamental change for how hospitals might operate.
Okay, so lots of upsides, clearly. Benefits for you as a patient, but also potential ripple effects for the whole healthcare system. But the sources aren't just cheerleading. They're realistic about the challenges, too, right? What are the big hurdles?
The biggest one, maybe the most obvious, is that it just can't replace everything. You still need physical exams sometimes. You definitely need in-person visits for diagnostic tests, imaging like X-rays or MRIs, certain treatment.
Right, you can't get blood drawn over Zoom.
Exactly. And then there are the tech barriers. The sources are pretty explicit about this.
Internet access, having the right devices.
Yeah, and they point out this can be a real issue for people in lower income brackets or in rural areas without great broadband. If you're a hospital trying to serve everyone in your community, relying only on tech could leave some people behind. That infrastructure gap is a serious consideration.
And security, privacy. We're talking about very sensitive health information here.
Absolutely critical. The sources hammer this point, the need for platforms that are HIPAA compliant. That's the big U.S. law protecting your health privacy. Making sure the tech meets those standards is complex but essential.
Plus, just knowing how to use the tech. Technological literacy, they call it. Not everyone finds navigating apps and video calls easy, especially, as the sources note, maybe older adults.
Right, so the system needs to provide support, education. It's not enough just to have the technology. People need to be able to use it effectively.
And then there's the practical side, insurance cost. It's not always clear-cut, is it?
No, coverage can vary a lot depending on your insurance plan, even where you live, because state regulations differ. And the co-pays or cost for a virtual visit might not be the same as an in-person one. That adds another layer of complexity for you and for the hospital billing departments, too.
So, okay, the potential is massive, but it's definitely got its limitations and challenges, things that need to be worked out, both for patients and for the providers trying to implement it.
Exactly. Navigating those hurdles is really key to making telehealth work well.
And speaking of navigating, one of the sources actually gives some really practical tips for you, the patient, on how to make a virtual visit successful. It's almost like a user guide based on understanding these systems.
Yeah, it's helpful stuff like making sure you're using a platform that's secure and reliable, IBA compliant, again, reflecting those privacy concerns we talked about.
And preparing beforehand. Writing down your symptoms, questions, having your medication list handy seems like basic good practice, but probably even more important to make efficient use of that virtual time.
Definitely. And the tech check. Testing your internet, your camera, your microphone before the appointment starts. Simple, but avoids a common frustration.
Being open and honest with the doctor, I guess that's always important, but maybe especially when they can't rely on as many physical cues.
Good point. And finally, knowing the next steps. What happens after the call? Prescriptions, referrals, who to contact with follow-up questions. It kind of highlights that you need to be proactive in managing that digital interaction.
These tips really do show it's a bit of a different dynamic, needing preparation from both sides, which brings us back around to that connection we mentioned at the start, Supremedic.
Right. So this company, Supremedic, the sources describe them as being focused on healthcare investments and providing key services to hospital owners. Things like helping with planning, design, getting equipment, recruitment, accreditation, the works.
So really involved in the nuts and bolts of building and running the physical hospital, the bricks and mortar, the staff, the equipment. They even take equity sometimes.
Yeah, they're fundamentally invested in that traditional physical healthcare delivery model centered around the hospital building itself.
And yet, the detailed breakdown of telehealth we've just gone through, the benefits, the challenges, even those practical tips for patients that came from content, specifically a podcast episode that's explicitly linked to Supremedic.
And that's what's so fascinating here. You've got a company deeply involved in the physical side of healthcare infrastructure. And they're not just, aware of telehealth. They're actively discussive of it, promoting understanding of it, including the digital infrastructure and delivery methods.
It's not just some trend they're watching from the sidelines. It seems like they're actively engaged with it. It really shows how those lines between physical and virtual care are blurring, not just for patients, but at the level of investment and infrastructure supporting hospitals.
Exactly. It suggests the future isn't likely to be purely one or the other, physical or virtual, but some kind of blend, a hybrid model. And companies like Supremedic seem to be positioning themselves to operate right there, helping their hospital clients navigate both sides.
That perspective coming through these sources really adds another dimension to understanding telehealth's impact. It's not just a new appointment option for you, it's actually reshaping the business and the structure of healthcare itself.
It's a pretty fundamental shift, and it's being driven from multiple directions, including by those who built the traditional system.
So let's try and pull the key takeaways together from this deep dive. Telehealth is, well, it's a complex, multi-part digital approach to healthcare. much more than just video calls.
Yeah, and it offers real benefits, making care more accessible, more convenient, providing new ways to manage chronic health issues. These impact you as a patient, but also potentially make the system more efficient.
But, and this is a big but, it faces genuine challenges. Technology access, privacy concerns, digital literacy, and the basic fact that it can't do everything that requires being physically present.
And understanding these points, maybe using some of those practical tips, can help you navigate this changing healthcare world.
And maybe the most intriguing point from these sources, seeing a company like Supreme Medic, so rooted in building physical hospitals, also deeply engaged in promoting the digital side of care, well, it shows just how intertwined these worlds are becoming. It's not really separate systems anymore, is it? It's one evolving ecosystem.
It really is a significant transformation happening at kind of all levels.
So as technology keeps racing ahead, and companies like Supreme Medic are investing in both the physical and the digital healthcare infrastructure, here's a thought to leave you with. If these lines keep blurring like this, what might a hospital even look like in, say, 10 years? How fundamentally different could the experience of care be, and what new ways of accessing it might emerge that we haven't even thought of yet? It's definitely a space to watch. The transformation feels far from over.
For anyone interested in learning more, the source material notes you can check out suprememedic.com. Thanks for joining us for this deep dive.